Welcome, 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 everyone, to this amazing conversation. Even before it starts, I know it's going to be amazing because Jordan and I always have amazing conversations. So today, I wanted to chat with Dr. Jordan Robertson about evidence-based protocols. And so if you've been in my world for any length of time, you know that I am a fierce advocate of having an online coaching program using a methodology so that we can provide consistent and repeatable client results and also feel really confident and feel really secure in what we are offering to our audience, where we're not sort of making it up on a whim and moving forward in that way. So that is the conversation we are going to have today. Welcome, Jordan.
Thanks so much for having me, Lori. We always have such good chats,
I
so I'm
know.
excited to hash this out.
I know, I know. So, for those that don't know you, why don't we start with you just sharing a little bit about who you are and what you do, and then we will dive right on in.
Yeah, so I'm a retired naturopathic doctor. Spent the last 15 years working in research, critical appraisal, which is a fancy term for knowing if research is correct, but also knowing if research should change what we do with patients. Not every study belongs in our day to day with patients, right? There's millions of studies published every year. Not all of them change the way we practice, but knowing the how and when we apply research to practice, that's really my expertise. I did practice as an ND for 15 years in that time, but also built the Confident Clinician, which is an integrative medicine database that finally solves the problem that we have nowhere to go for evidence-based information that's focused on practitioners who practice nutrition and evidence-based care. So that's what I do. My skill set is in research and understanding how to tie together multiple data points to help people come to some sense of truth, or as close as we get to truth in science, around how to work with patients in their field.
And one of the things that I love um, when I consume your content is just how real and matter of fact you are. And one of the things that I admire about you so much is that you really lead with the research. So you and I see eye to eye on the Diet Coke conversation, uh, for example. And I think that that's so refreshing, and I think that's one of the reasons that you've been in practice and have been as successful as you are, not just in your clinical practice, but also with the Confident Clinician and really teaching alternative healthcare practitioners and care providers how to avoid being dogmatic and how to avoid trends and really look at the evidence and also the person.
It's funny when you like map out my strengths finders, the things that are at the bottom are all the emotional things where we make decisions. So my actual lowest is empathy, which always like surprises everyone because if they've ever worked with me, they're like, "You're empathetic." I have very good tactical empathy. But if you want someone at the helm of helping us make decisions based on facts and logic and research, you don't want all of those emotional like tendencies to naturally creep into decisions. And where I can really help clinicians is helping them tease those two things apart. We all got into healthcare for very emotional reasons, right? I don't think anybody had like a graphed spreadsheet on what they wanted to do in healthcare. We chose it because of a passion, because we love it. But that's difficult to separate that piece with decision making, right? Where
Mhm.
decision making actually needs to have a healthy dose of logic and pragmatism with passion, as a side and not the driving force in how we make decisions.
Mhm. And at the same time too, I think one of the things that will help clinicians and practitioners and coaches stand out is actually sort of is what are the words I'm looking for? Like setting themselves apart by not following the herd, right? By not jumping on the bandwagon of the like dogmatic trendy thing, and really looking at the condition that they are a specialist in and looking at the research and providing this like evidence-based care methodology that is sort of devoid of all of the judgments and opinions that we see on social media. Is that, how you work with clinicians?
Yeah, I want clinicians to get really married to the outcome, maybe not. And I think having a methodology and a framework for how you work with patients is brilliant, right? There should be a rinse and repeat for a lot of the things you do with patients. It helps save you time. It helps streamline the way that you deal with patients. It helps you communicate what it's like to work with you so much better. I think having a methodology is amazing. I think where we struggle is we create an identity around some of the treatments that we offer patients when really what we should get married to is the outcome, right? You want to
Mhm.
help people with their digestion. Getting married to a particular probiotic as part of your methodology is problematic, right? We would be really upset if a conventional doctor got married to a particular drug. We would want them to be able to see all the other solutions for that condition, or if that drug ended up getting recalled, we'd want them to change their mind. But in
Mhm.
integrative medicine, we often get connected to how we help patients versus recognizing our methodology as a structure of how we walk with them through that journey. When you get connected to the actual thing that you're giving them, that's where you start to have bias. And that's where you can definitely run into some challenges, especially as research evolves and changes. So I love to coach clinicians around getting connected to a framework and how they support patients from assessment to maintenance, right? And all the steps in between. But the actual things you prescribe, throughout, or the lab tests you run throughout, should be something that can shift when research shifts. And that's why we need a resource to go find those things, because I'm not suggesting you reinvent the wheel for every patient. I'm suggesting you need a strategy to work with them. And then as research shifts, you maybe stop giving fish oil, or you start giving something else that is more scientifically based in that moment.
Yeah. And I think operating in that way is what sets you apart as a practitioner or as a coach, because you are now, like you said, focused on the best possible outcomes and providing the best possible quality of care. And I think for so many practitioners and coaches, that is not at all how they were taught. Right? And you and I have had many conversations around this because it just makes us violently angry. because it because it is not in the best interest of the clinician nor the patient or the client to operate that way. Right? In terms of being married to a particular way of operating or a particular supplement or a particular diet or a particular belief or any of those things, we have to be able to be fluid and learning how to source and review research, learning how to make decisions, even though you might have a methodology or a protocol, being able to say, you know what, I need to modify this because there's been new research or even feedback from the 30 clients or the 30 patients that have gone through it that said this is too hard. Even though you're like, no, you must do these 1700 things, right? And they're like, it's too hard. It's too hard to follow. And so being really flexible in your beliefs and in the way that you operate, I personally think is also, a requirement for success.
Yeah, it's funny. I think as an industry, we're a little scarred from the past where we didn't have a lot of evidence for what we did, right? So if we go back 30 years ago, we put people on healthy diets, we gave them some supplements, we talked to them for like hella long time, and they got better, right? But we had no evidence for the diet, no evidence for the supplements, and
Mhm.
we had barely scratched the surface on evidence for, I always call it the provider effect, not the placebo effect, but the provider effect, where time spent with your clients actually changes how they feel. And we now know that, right? There isn't a chronic disease out there that we're not studying the impact of connection and provider time. But 30 years ago, we had no evidence for any of it. And so it's like we are scarred from that experience where we had to defend ourselves tooth and nail, where
Mhm.
we were like, but my client's better. And then the conventional medicine, would say, well, there's no evidence for that. Fast forward millions of studies on nutrition, right? Like thousands and thousands of studies on supplements. We have a lot of evidence for what we do now. We deeply understand, although still growing, the provider effect. The challenge is that we haven't let go of some of that feeling that we had 30 years ago, where we had to, go into every conversation with our dukes up. We had huge chips on our shoulder, and we felt like no one understood what we did and had to almost be oppositional to stand out,
Yes.
right? Like we had to take this contrarian stance for people to want to work with us. And even in people's marketing, you would see like, conventional medicine's terrible. They'll never help you. Come to me. Well, now we have much more understanding of why certain things work, what doesn't actually, and yet we've not divorced ourselves of some of those things that don't work, right? We still use some of those things, and we've not fully embraced this more integrative opportunity that we have to work alongside conventional medicine. And I think it's coming from that wounded past. And a lot of the, even when in the schools we're being taught this, like maybe not, they're not saying it explicitly that it's contrarian, but we'll like dig to the ends of the earth to find an alternative to lower cholesterol. But no one's asking if we should bother doing that, right? Like, why don't they just take the medication and we can help them in so many other ways? So
Mm.
I think that there's this like historical, I'll call it trauma in our whole
Mhm.
industry where we feel like we never had evidence for what we did. And so now we don't bother looking at it. But we really need to step into an authority on this subject and be the authority on research and nutrition, because no medical doctor has that expertise. Like, what an amazing opportunity. They don't have the time to talk to their patients as long as you can. They cannot elicit a provider effect in a 7-minute health appointment every 6 months. And you can. Like, look at how amazing you could be and what a gap you can fill. But it's really only if we step away from that hurt that we had from years and years ago about there not being evidence for what we did.
Mhm. And I also think too, just in my own experience being, a 43-year-old woman and having friends in this age category, it, in relation to stepping away from that hurt and all of that, that I think creates such an opportunity as a nutritionist, as a coach, as an ND, as a functional medicine coach, to be able to um, ch- access training so that you know how to assess research, you know how to find it, you know how to snuff out the bias in the research, you know how to like judge the research and then apply it to whatever it is that you're doing, because the conventional medicine system isn't doing that and they're not trained in that, right? They're like, I was just chatting with a friend over the weekend and she went to her doctor. She's 49 years old and she went to her female doctor, and her female doctor said that there's no scientific evidence to support hormone therapy for perimenopause. Right. And it's just like doctors are still saying these things, which is not true. And so, what a marvelous opportunity for all of us in alternative healthcare to fill that gap for people, because that gap exists. And we want to make sure that we are credible. We want to make sure that we are, acting ethically and responsibly and with inside our scope of practice. And the easiest way to do that is by using evidence, right? It's by, and also, I know for myself that it also improves confidence when you can be like, nope, I've read, 10 different studies that all point to the same conclusion. So we're going to try this. Right.
Yeah, totally. And that was even one of my reasons for creating the Confident Clinician, is that even if you were like a well-versed veteran clinician who'd been practicing for 10 years, you had nowhere to go to see what everybody else was doing.
Yeah.
right? Nowhere. It was like you would like what, text your friend, hop in a Facebook group. Like we're supposed, we're doctors or clinicians with titles. That's not really where we should be grabbing our information or our confirmation from. There really should be this sort of unified discussion around what we're all doing here. And that was part of one of the reasons that I created TCC, was so that people had a place to go, regardless of whether they were day one in practice or had been in practice for 20 years. We all grow confidence in confirmation in what we're doing. It's not, and I think we can, I've seen lots of your great work before where you're like, don't take another course. You don't need more information. You need to figure out how to be more confident and be more strategic with the information you have. When we're delivering information to clinicians, it's not always about something new. Sometimes it's about enforcing that what we currently know is even more true than what we thought, right? And
Mhm.
that grows confidence, because imagine sitting across from your client and saying, this is what we do for this right now. You knew that thousands of other clinicians were also delivering the same thing, and that the information you were giving was 100% correct. It lets you field questions better. It lets you stand up against their doctor better, right? Like all the things that grow confidence as a clinician. That patient will never forget that experience of what it's like to listen to you share what they're doing with, when you have
Mhm.
that level of confidence. And that's what makes them refer their friends. That's what makes them bring you up over brunch. Not that their vaginal dryness is better. It's the way you made them feel in that appointment when you shared that with them. That's what makes
Mhm.
them refer their friends.
Mhm. And I think it's so interesting these days, as I mean, you and I have been online for a very long time, and, to be able to see the shifts and changes in our industry, and to have clinicians, coaches, practitioners want to practice more online. And this idea of specializing, right? This idea of like niching down, where like I know that I was taught a little bit about a lot of things. And, as I'm sure naturopaths were, health coaches are, personal trainers. And so that doesn't like really translate online well, like if you're sort of a generalist. And so that's why I love what you're doing with the confident clinician, because you are giving specialized education. You're giving specialized training. You're teaching clinicians how to dive deep into one specific area to actually become an expert, right? Not to just be like, I'm the expert on so and so. Right, to actually become the expert. And when you have that knowledge and when you have that training, that also obviously enhances confidence. And I'm all for taking that kind of training, but I am not for, to say it bluntly, taking a generalized, certification or more generalized knowledge, because that's, in my opinion, especially if you want to be successful online, generalized knowledge isn't that helpful to set yourself
Totally.
apart.
Yeah, it's funny. I always say I don't know who benefits more from the confident clinician, people that have niched or people who are running more family practice or generalist practice, because I can make a really good argument for both. I mean, people that have niched, if someone, that you're supporting with menopause walks in your door and now suddenly has asthma, my guess is that you're not referring them out, right? My guess is that you want to try and support them. And so, but if that's not your bread and butter, like, gosh, you've got an awful lot of work to do after hours in order for you to figure out what to say to them. I wanted you to have somewhere you could go and at a moment's notice, keep the confidence, right? Like
Mm,
keep the trust
smart.
that you've built. You
Mhm.
built trust with supporting them with their menopause. Let's keep it, right? By being able to step in and say, look, this is not my total bread and butter, but I do know how to get us started. So I wanted our niche-based clinicians to have a
Smart.
resource they could go at a moment's notice and ask our AI and be like, okay, what do I do for a menopause person who has asthma now? And it give them an answer in that moment so that they never missed a beat. They didn't actually lose the trust or lose the confidence in their client because they could help them immediately. but also our deep dive content. And we're the only database at this point that delivers all of our content live the first time so that you can actually hear how we came up with the answer. We're not just giving you a flat protocol that says, give them a 5% EGCG cream for their acne. We actually walk you through the studies and be like, all right, well, this study gave them 10% and it burned. This study gave them, 0.1% and it didn't work. This study gave 0.5% and here's what the outcomes were. Here's how to have it compounded at your local pharmacy. It gives that skin practitioner the level of confidence they need to sit with their patient and say, this is why you have to get this product and not this one off Amazon, right? And I wanted them to feel that way about their own subject, like they understood the research inside and out so that they could sit across from their patients and be incredibly well versed. Our general practitioners are able to dip their toe in that level of content as much as their heart desires, but it's really meeting both of their needs,
Mhm.
right? It's that like information at a moment's notice so that you can keep the confidence you've worked so hard to build, but also lets you deep dive so that when you're ready to become the absolute boss at something, or you got a talk coming up and you're like, well, what am I going to say about eczema in this talk I'm giving? You can actually build your content from ours so that you know that what you're delivering is evidence based and it helps you feel more confident in it.
Such an amazing resource. I was remembering back to when I was seeing clients, and someone would come in who was like, "Oh, I have seasonal allergies." I'm like, "Do you also need to lose weight? Because that's really, you know, like I can help you lose weight, and then I'll work on your digestion for the seasonal allergies, but like that's all I got for you, like that's it." And so I remember thinking, like, that's such a shame that I couldn't just, support them in that way, at least at the very beginning stages. I can see how that would be so helpful for like a general practice, especially for people who really do value staying up to date with the research. Again, like I just keep thinking about this opportunity to separate yourself away from the masses. And the way that you do that is by demonstrating a level of knowledge and a level of confidence that others don't have. Right? It's not by saying the same thing that everybody else is saying. And even to your point, like the provider effect, right? Being able to show up with a level of empathy and bedside manner that seems to be lost these days. Coaching isn't taught, funny enough, in any of our professional training, right? It wasn't taught in mine. I know it wasn't taught in the naturopathic college. Like, it's not taught, which is hilarious, but is also such a requirement to be able to get people to actually follow through consistently, right? And so being able to confidently show up and inform the clients and the patients, okay, this is what you need to do and here's why you need to do it, and then have other elements to be able to help them and hold them accountable is critical to their success and the outcomes that you're being able to get for them.
Yeah, exactly. And it's funny, I just talked about this on another podcast about the lack of coaching, given that that's like maybe the thing that makes the biggest difference to patient success and compliance and even
Mhm.
medication compliance. Like I used to say that like one of my expertise was helping patients comply with their medication. Like I didn't prescribe them, right? But I was able to help them figure out how to get those things into their life, answer their questions about their medication so they felt more confident about it. That was one of my roles, right? Was to help them comply with someone else's treatment. Um, but one of the challenges we have as clinicians is that we're trying to do too many things at once. And I think
Mm.
that's, if you really just sat back and could relax in an appointment, your natural tendencies to help, your natural passion and ability to support, your ability to really listen to your patient would be amazing. The problem is we're not relaxed, right? We're like frantically charting. We're hoping they don't say anything about any other condition that we're going to have to
Yeah.
now look up when they go home.
Yeah.
We're like trying to like, framework out some kind of referral letter because we realize they need to see someone else. We're like kind of still listening to what they're saying. And I'm not saying we're not listening. I'm saying that those appointments are so full of obligation and responsibility on on the provider's part, because we've made
Mhm.
it all your responsibility, knowing what's the latest research, how to deliver it in a, concise way, your communication, your charting, if that's, what you're required to do. There's so many things you're responsible for in that patient interaction. And we're like some of the only professions that don't have a support in order for you to do that.
Mhm.
Right? We're like the only profession that doesn't have a published methodology, like a standard of care that we should follow. We're the only profession that doesn't have that. And so, of course, you feel overwhelmed and can't focus on the coaching part in your visits because your brain is exploding trying to figure out how you're going to manage all the other pieces of your work.
Yeah. I know I remember, like, for me, I always think back to when I was in nutrition school and, like, how funny it is now that I can look back and go, it's so interesting how I was taught, right? It's so interesting and how much the profession has evolved. And I think the ability to go online and the ability to have a virtual practice, whether you're sort of still in this, sort of general clinic mode and you're just doing it virtually, or you have a brick and mortar, or you are, working online with some type of like coaching program. Um, it's so interesting to me how that whole aspect, like a standard of care and even onboarding and offboarding clients and like all of the sort of operational things that are so important to the patient's experience, which then obviously determines how well they follow the protocol, was not really, at least for me anyway, it wasn't really taught. And so I love that you are covering this because again, that just helps increase confidence when you know that your onboarding is fully supportive and is in the best interest of that client experience, that patient experience. You feel like a baller. Like you're just like, no, my program's the shit. What I'm doing is the shit. Like you feel confident because you're not grasping because you don't know what you're doing.
Yeah. And that's one of the things we talk about. And this is maybe my coined term, is that I always want clinicians to feel like they're inside the topic, right? Like
Mm.
they know it so well. They're like in it, they're inside it. And the reason I use that term or that feeling that I want to evoke in a clinician is that you know it so well that you can see between the lines, right? You can see the people that are not served in the
Yep.
current healthcare model. If you
Yep.
deeply understand the condition you're working with, you can see who's being missed, how their diagnostic delay is affecting their long term health, right? Most
Mhm.
conditions have diagnostic delay. And if you don't know
Mhm.
that number, go look it up. This is one of the best marketing things and just patient care things is to figure out what the average time to diagnosis is for the condition that you work with. Is it 2 years? Is it 4 years? Is it 10 years? There are so many conditions that we work with as integrative practitioners that number, that diagnostic delay, is something that can be shortened by working with you. So rather than them taking it 6 years for someone to figure out and a million doctor's visits, they can come and see you and expedite that. Like, gosh, people would pay a lot of money for
Yes.
an answer to why they feel the way they feel. But I want clinicians to be inside the topic, to know, how to support the side effects of the most commonly used medications. We're not going to stop using them, but let's figure out how to support patients while they're on them. When you have that level of understanding of your topic, you do feel like a baller because you could sit, at a table beside someone's medical doctor and be like, you do you. I bring a lot to this conversation, and I always felt that way when I was working with my patients. I always felt like I just belonged at the table because I knew what I was doing was so valuable to move the needle on some of those areas that are being missed. We don't
Mhm.
have to grasp at straws. We don't have to be oppositional. We actually just have to slide ourselves into the areas of healthcare that are failing. And that's
Yes.
not a hard nowadays.
No, and I think that is the biggest takeaway for coaches, for practitioners. It's not a replacement. Our job as coaches is to literally slide in and fill the large gaps that the conventional medical system is failing at and likely not able to fix for a very long time, if ever, right? If ever. So like, yes, there is a place for you when you realize that you fill those gaps. That's what you bring to the table as a coach, as a practitioner, right? The accountability, the support, the evidence, the up-to-date evidence, right? The client experience, the provider effect, all of these things that the going to see your doctor, even a specialist, they don't do, right? They don't do. And they're often, in my experience, my daughter has a genetic condition. So we are very much involved in the conventional medical model. They are often also not looking at the whole person. They are looking, and this is a different conversation, but they are very much looking at, the one result of the one blood test that they ran, and oh, okay, we're just going to fix this. But they're not looking at the whole person, and how that one result could be coming from something else or connected to, or whatever the case may be. So this is a really good opportunity to separate yourself and to say, here's what I provide as a clinician, as a practitioner, as a coach. Here's how I can get you results faster, right? Where can people go to find out more about the Confident Clinician and you?
Mhm. That's a great question. Yeah, and our doors are actually open right now. We only open twice a year for onboarding with clinicians. We're very careful in how we pull you in. I think new technology is always something that takes some time for you to integrate, and that onboarding experience for us is incredibly important. We're asking you to revolutionize the way that you work with clients, and we realize that that has to be done carefully. And so we only open twice a year. So the best place to find us is at confidentclinicianclub.com. And there you can get access to information about the membership. We do have some of our courses as pay per use, but they're almost all included in the membership. So I highly discourage people from buying courses as a one off because it doesn't give you that fulsome experience of being a member. We also have a really great Instagram page that does give you some clinical insights and ideas on how to stay up to date in your practice or with your clients, and how to think differently about technology. I think sometimes as knowledge workers, we can get a little touchy about the use of technology, that it's going to replace us or that we're obsolete. Technology really should free the way you feel in your day-to-day interactions with your clients. Like, imagine what it would feel like if you didn't have to do a lot of what you're currently doing. You could actually just show up as your like amazing authentic self and not be stressed about your patient work. That's really our goal.
Yeah.
But the Confident Clinician Club on Instagram, which you can also find through my personal handle, which is Dr. Jordan ND, so Dr. Jordan ND. Those are great places to find us.
Amazing. Thank you for this conversation. And thank you, everybody, for listening. I really do hope this was helpful. And I hope that it reinvigorated your motivation to serve, right? The motivation to serve and the motivation to become even better at what you are already doing. So thank you, everyone. And we will chat soon. Bye.
Thanks, Lori.